My name is Sarah Bosha. I'm an international human rights lawyer, director of legal research and human rights at the O'Neill Institute for National and Global Health Law at Georgetown University Law Center. My project is entitled Advancing Women's Health in Climate Vulnerable Communities, Addressing the Intersection of Climate Change, Albinism, and Health Systems. Because of this lack of pigmentation, persons with albinism are 1,000 times more vulnerable to skin cancer than persons without albinism. As a result, and as a consequence of this, climate resilient and inclusive healthcare systems are a matter of extreme urgency and a matter of life and death to preserve the health of people with albinism, particularly women and infants with albinism. The environmental shocks associated with climate change have an extreme and significant impact on the health of women. We've learned from research that extreme heat waves, extreme weather conditions or disaster, even poor air quality impacts pregnant women, resulting in preterm birth or low birth weight as some of the issues that they face. Women with albinism and pregnant women that give birth to children with albinism are equally affected by these shocks that are climate related. However, compounded on top of those shocks are the extreme risk of developing skin cancer due to a lack of access to sunscreen lotion, protective clothing, and the necessary information and trained healthcare officials that can support the climate resilience of this particular group of women with albinism and women who give birth to infants with albinism. To the left of my screen, you'll see a young toddler, possibly an infant, potentially below the age of 2 years old, who has evidence of sunburn, scabs that have healed there. And research has shown that when infants with albinism do not have access to sunscreen lotion from birth, there can be chronic skin damage by the age of 12 months, which can predispose them to skin cancer. What does this mean in simple terms? One of the challenges I faced in doing this work was securing funding to begin the pilot of a storytelling project, which is designed to elevate the voices and the solutions of persons with albinism on what they think climate resilient healthcare systems should have for them. The impact of these storytelling projects was incredible. We were able to understand that access to sunscreen lotion, a very basic preventative medicine, an essential medicine for persons with albinism, was extremely low in Zimbabwe and close to non-existent, particularly for communities in rural areas. We were also able to understand that there was a lack of knowledge among healthcare workers about what to tell a woman who gave birth to a child with albinism about how to protect that child's skin from chronic sun damage and, of course, eventually skin cancer. Some of the outcomes of this project, this pilot, is a report that we will be releasing together with the partner organizations we worked with in Zimbabwe on January 29. In addition to my hope that I would be able to expand this project well beyond Zimbabwe, deepen the impact in Zimbabwe, but expand it to other countries as well, where there are other groups that work tirelessly to support the health rights of persons with albinism. I'm plugged into the ongoing global campaign to restore sunscreen lotion to the World Health Organization essential medicines list. And my hope is this report could add to that growing chorus of voices that are saying, in the face of climate change, we need to act urgently. Otherwise, people with albinism will continue to suffer needlessly, and women with albinism and mothers of infants with albinism will suffer even more. Some of the things I learned as a result of being on this journey that I have been incredibly grateful for, first of all, is the power of a coach. You know, the power of someone who can tell you some hard things, but also tell you some encouraging things to push you forward and to propel you to the better and best version of yourself. My hope going forward is that as I've begun to exercise my power, I will be able to realize more funding to be able to work with the colleagues that I have partnered with to achieve greater things, and in growing my own leadership to be able to support others that are working in this area to also develop and deepen their leadership.